Have you ever stopped to think that your heart might be sending warning signs, but they are so subtle that you don't even notice? Ignoring these symptoms could be a fatal mistake. What many people don't know is that heart failure rarely appears without warning. It starts silently, with hidden signs that most of us ignore until it's too late. But you don't have to be one of those people. Today, you will discover the 5 hidden signs of heart failure that are going unnoticed by many and may be occurring with you right now. These signs, often mistaken for minor issues, could be the key to saving your life. The good news: there is a way to act now and prevent the worst. Let's explore these signs together and, more importantly, what you can urgently do to protect your heart health before it's too late. The 4th sign will surprise you. Let's move on to the 1st sign. Frank's sign, the small crease that can say a lot about your heart. Imagine you're getting ready to go out. As you pass by the mirror, something catches your eye, a small crease on your earlobe. You've never noticed it before. Has it always been here? You wonder. At first, it may seem like something totally insignificant, just a detail of your body that you've never paid much attention to. But this simple crease might be trying to tell you a story about your heart, and it could be a story worth hearing. Let me explain. This crease, known as Frank's sign, was discovered by a doctor named Dr. Sanders T. Frank in the 1970s. He began to notice that several people suffering from heart diseases had one thing in common: a diagonal crease on their earlobe. Strange, right? Who would have thought that something so simple could be linked to something as serious as the heart? But how does this work? What does this crease have to do with your arteries? Well, you know those arteries responsible for carrying blood to your heart and brain, known as the coronary and carotid arteries? When they become blocked by fatty plaques, the heart can become overloaded. And Frank's sign can be a warning sign of this blockage, especially in younger people. It's as if the body is trying to tell you, hey, it's time to take a look at your health. Have you ever found yourself worrying about your heart health, feeling that, despite all your efforts, you're not doing enough? Imagine if you could follow a clear and simple plan that, in just 30 days, could transform your heart health. Considering the challenges of keeping heart health in check, I've made my ebook available, 30-Day Challenge for a Healthy Heart, 30 Steps to Clean Your Arteries in 30 Days, and I've left it for you to download right now in the first pinned comment. This 30-day challenge isn't just about superficial changes. It's about ensuring your heart is stronger, your arteries are cleaner, and your life is longer and healthier. These are habits anyone can implement, no matter how busy their routine is. And the best part? These habits can be easily incorporated, becoming a natural part of your daily life. Click on the first pinned comment, as we have very few units left and will soon be taking it down. Click now and get your ebook. Now, hold on. Before you start worrying too much or calling the doctor, it's important to understand that this crease alone is not a diagnosis. Frank's sign has low sensitivity, which means it's not super precise. In other words, just because you have the crease doesn't necessarily mean you have artery problems. It could simply be something genetic or even related to natural aging. But what makes this crease interesting is that when it appears in people who already have other risk factors, such as high cholesterol, high blood pressure, or a family history of heart disease, it can serve as an extra signal that something might not be right. And let's be honest, when it comes to the heart, any alert is welcome, right? Now, imagine this. You discover the crease, get some tests done, and even if everything is fine, you decide to make some changes to your routine. You start eating healthier, exercising a bit more, and maybe even quit smoking. All of this will help not just your heart, but your overall health as well. And in the end, that little crease, which initially seemed like just a silly detail, might have been the nudge you needed to start taking better care of yourself. So, if you or someone you know notices that crease on the ear, it's worth giving it a little extra attention. There's no need to panic, but consulting a doctor to ensure everything is okay with your arteries is always a good idea. After all, our bodies have subtle ways of warning us that something might not be right, and listening to those signs can make all the difference. Before we continue, I noticed that you haven't subscribed to the channel yet. We'll always be bringing you news about the care you should take for your heart. Now let's move on to the next sign: hair loss on the legs, a warning signal. Have you noticed that the hair on your legs is thinning or even disappearing? This may be a sign that something is wrong with the blood circulation in your legs. Hair loss can indicate the presence of peripheral artery disease, PAD, a condition resulting from the obstruction of the arteries responsible for supplying blood and nutrients to that area. PAD occurs when the arteries that supply the legs narrow or become blocked by fatty deposits, cholesterol, and other substances. This blockage prevents blood from flowing freely, leading to a series of problems, including reduced hair growth. This happens because, without adequate circulation, the legs do not receive the oxygen and essential nutrients necessary for healthy hair development. If you notice that the hair on your legs is disappearing or growing irregularly, it's important to pay attention. Other symptoms that may accompany this condition include weakness or pain. You may feel pain in your legs when walking or engaging in physical activities. This pain may subside when you stop moving. Changes in skin color. The skin may appear pale or have a bluish tint, which can be a sign of inadequate circulation. Coldness in the legs. The legs may feel cooler to the touch compared to other parts of the body. Factors contributing to PAD. Several factors can contribute to the development of PAD, and it's essential to be aware of them. High cholesterol. Excess cholesterol in the blood can form plaques in the arteries, restricting blood flow. High blood pressure. Hypertension, over time, can damage the artery walls and lead to narrowing. Diabetes. Elevated blood sugar levels can damage blood vessels, making circulation difficult. Sedentary lifestyle. Lack of physical activity not only impairs circulation but can also lead to weight gain, an additional risk factor for arterial diseases. What to do? If you notice hair loss on your legs, it's crucial to consult a doctor. They can perform tests, such as a Doppler ultrasound, to assess blood flow and determine if there are any blockages in the arteries. If PAD is diagnosed, don't panic. There are several changes you can adopt to improve vascular health and reverse the problem. Regular exercise. Physical activities like walking, swimming, or cycling help improve circulation and strengthen the heart. Healthy eating. A diet rich in fruits, vegetables, whole grains, and lean proteins can help control cholesterol and blood pressure. Reducing the intake of saturated fats and sugars is essential. Quit smoking. Smoking is one of the main risk factors for PAD and other heart diseases. Quitting can significantly improve blood circulation. Diabetes management. Keeping blood sugar levels under control is crucial to prevent damage to blood vessels. In summary, hair loss on the legs should not be ignored. It is a sign that your body may need special attention regarding vascular health. By recognizing these signs and seeking medical help, you can make positive changes in your life and ensure that your legs and your heart stay healthy. Let me know in the comments if there's any symptom that concerns you. We'll help you with it. The next symptom is xanthelasma. Eyes that tell a story about your health. Imagine you're chatting with a friend at a cafe. While he talks about life, you can't help but notice those small yellow plaques around his eyes. What could they mean? This is xanthelasma, and it's more than just a curious detail in his appearance. It could be a window into his heart health. Xanthelasmas are like little alerts that appear on the skin, usually on the eyelids. These yellow or whitish plaques are deposits of fat that accumulate under the skin and may be a sign that cholesterol and triglycerides in the blood are elevated. Sometimes, this phenomenon is seen merely as an aesthetic aspect, but it's important to pay attention to this warning. Once, a man named Carlos began to notice some yellow spots on his eyes. At first, he thought it was just a sign of aging or sun exposure. But when he went to the doctor for a routine checkup, the doctor noticed these plaques and immediately asked a few questions about Carlos's health. "Carlos, do you have a family history of high cholesterol?" the doctor asked. Carlos was surprised, as he knew his family had always had heart problems. The doctor explained that the xanthelasma could indicate that his cholesterol levels were higher than they should be. Carlos didn't know it, but xanthelasmas can be an important indicator of cardiovascular risk. They serve as a warning for him to look at his health more critically. High cholesterol can lead to serious problems like heart attacks or strokes, and these plaques are a clear sign that it's time to take action. Motivated by this discovery, Carlos decided he needed to change his habits. He began to pay more attention to his diet. Instead of fried and processed foods, he opted for dishes full of fresh fruits, crunchy vegetables, and whole grains. With each meal, he felt more energized and ready to face the day. In addition, Carlos started exercising regularly. He found pleasure in long walks and even joined a local running group. Over time, he noticed that not only was he feeling better, but the plaques around his eyes were starting to disappear. At his next appointment, Carlos was nervous yet excited. He wanted to know if his lifestyle changes were making a difference. The doctor ordered some blood tests and, upon reviewing the results, smiled. "Carlos, you've done a great job. Your cholesterol levels are much better now. Like Carlos, you may also have small hints from your body asking for attention. Xanthelasma is just one example of how heart health can manifest. If you notice yellow plaques around your eyes, don't hesitate to consult a doctor. They can perform tests to assess your cholesterol and triglyceride levels and, if necessary, help you create a plan to improve your health. So, the next time you or someone you know notices xanthelasmas, remember, these little signs can tell a deeper story about heart health. And with some simple lifestyle changes, you can rewrite that story for a healthier ending. I noticed you forgot to like the video. Show us that you care about your heart health and give it a thumbs up. So let's move on to the next sign that your heart may be weak, the arcus senilis. Understand the sign and what it can indicate. Have you ever noticed a white or gray ring around someone's iris? This phenomenon is known as arcus senilis, and it can have significant health implications, especially for people under 45. Let's explore together what this sign may mean and why it deserves your attention. The arcus senilis is a deposit of lipids, fat, that accumulates on the outer part of the cornea, forming a visible ring around the iris. Although many think this ring is merely a sign of aging, it can indicate more serious health issues. This ring is often associated with elevated cholesterol levels, especially in younger individuals. When cholesterol accumulates in the body, it can deposit in various locations, including the eyes, resulting in arcus senilis. This condition is a sign of dyslipidemia, which is characterized by an imbalance in lipid levels in the blood, such as cholesterol and triglycerides. Having elevated cholesterol is not just an aesthetic issue, it is a significant concern for cardiovascular health. The presence of arcus senilis can serve as a warning of increased risk for heart diseases, such as heart attack and stroke, AVC. For those under 45, this sign may indicate that something is wrong with cardiovascular health, and it is crucial not to ignore it. What to do if you notice arcus senilis? If you or someone you know notices arcus senilis, don't hesitate to seek help from a healthcare professional. Here are some recommended steps. Medical consultation. A doctor can order blood tests to assess cholesterol and other lipid levels in your body. Blood tests. Tests like the lipid profile measure total cholesterol, LDL, the bad cholesterol, HDL, the good cholesterol, and triglycerides. Lifestyle changes. If the tests indicate elevated cholesterol levels, the doctor may recommend lifestyle changes, including balanced diet. Prioritize a diet rich in fruits, vegetables, whole grains, and lean proteins. Avoiding foods high in saturated and trans fats can make a significant difference in cholesterol levels. Regular physical activity. Incorporating exercise into your routine, such as walking, running, or activities you enjoy, helps improve cardiovascular health and control cholesterol. Weight management. Maintaining a healthy weight is essential for reducing cholesterol and improving overall health. Regular monitoring. Get periodic blood tests to track cholesterol levels and make dietary and lifestyle adjustments as necessary. The arcus senilis may seem like just an aesthetic change, but it is a sign that should not be ignored. It can indicate elevated cholesterol levels and, consequently, an increased risk of heart disease. Therefore, if you notice this ring around the eyes, seek medical advice. Taking care of your cardiovascular health is essential for living well and preventing future complications. And always remember, whenever you have doubts about how to take care of your heart health, the solution is within your reach in a quick and practical way. Just grab your digital book, 30-Day Challenge for a Healthy Heart, 30 Steps that will clean your arteries in 30 days. It's very important that you get it right now before the units run out. And so, are you ready for the last sign of a weak heart? Now I will talk about leg and foot ulcers, a warning for your health. Imagine you're getting ready for a nice walk, but as you put on your shoes, you notice a wound on your leg that won't heal. It may seem like just a minor inconvenience, but it can be a sign that your body is asking for attention. Non-healing ulcers on the legs and feet can be a sign of serious circulation problems. These wounds typically arise when blood cannot flow properly to the extremities of the body. This can happen for various reasons, such as blocked arteries, often associated with serious conditions like peripheral artery disease. When the arteries are obstructed, blood flow becomes compromised, and the skin on the legs and feet does not receive the necessary nutrients and oxygen for healing. What should you be aware of? Non-healing wounds. If you notice an ulcer on your leg or foot that persists for weeks or months, this is a warning sign. Pain or discomfort. Sometimes, these wounds may be associated with pain, especially when walking. Color changes. The skin around the wound may become reddened or darkened, indicating circulation problems. If you identify with this situation, it is crucial to seek medical attention. Early detection can make all the difference. The healthcare professional may order tests, such as ultrasounds or blood flow tests, to better understand what is happening with your circulation. Treatment for leg and foot ulcers may include direct care. It's crucial to keep the wound clean and covered. This helps to prevent infections that can worsen the condition. Changing the dressing regularly and following the care instructions from your healthcare provider can significantly aid in the healing process. Medications. In some cases, antibiotics may be necessary if the wound shows any signs of infection, such as redness, swelling, or discharge. Your doctor will determine the right type of medication to help combat the infection and promote healing. Lifestyle changes. Incorporating regular exercise into your routine can greatly improve blood circulation, which is vital for healing ulcers. Activities like walking, swimming, or even gentle stretching can help. Additionally, maintaining a healthy diet rich in fruits, vegetables, whole grains, and lean proteins can support your overall health and improve blood flow. Management of health conditions. If you have diabetes, hypertension, or any other chronic conditions, it's essential to manage them effectively. Keeping your blood sugar level stable and your blood pressure in check can reduce the risk of developing ulcers and other complications. Regular checkups with your healthcare provider can help you stay on track. If you've noticed any of these signs, start taking care of your health today. The quickest way to do this is by getting the digital book, 30-Day Challenge for a Healthy Heart, 30 Steps that will clean your arteries in 30 days. Units are running out, so go to the pinned comment and grab it right now. And remember, leg and foot ulcers are not just common wounds, they can be warning signs of more serious problems. Pay attention to your body and don't hesitate to seek medical help if you notice any changes. If you enjoyed this information and want to learn more about how to take care of your health, subscribe to our channel. Here, you will find valuable tips and essential guidance to keep your heart healthy. Don't miss out.